Thank you for your time and attention. I understand that you've had a longer day, so I appreciate you still being here. As mentioned, my name is Dr. Charis Chambers, also known as the Period Doctor on Instagram. Oh gosh, I was actually asked to speak last year, but I was heavily pregnant at the time. And I was like, it wouldn't be best. But I'm very excited to be able to be here with you today. My hope is to kind of prove this somewhat bold statement that reproductive education is not just puberty preparation or even period management. It is a maternal mental health infrastructure. So go with me, if you don't mind. So I want to talk about maternal well-being. And we can go in advance. I learned what maternal meant in this moment. So this was the moment, the very first moment I held my son Joshua, who has changed my life in the most beautiful way, certainly. And it was something that was indescribable. So I'm sitting here as a whole OBGYN who's delivered hundreds of patients. And I remember my patients asking me with intrigue and this beautiful curiosity, "Are you a mom?" And I wasn't at the time. I was in my training. I hadn't met the right one. Met a lot of the wrong ones. But I hadn't met the right one. And I was immediately offended by that question. I was offended because my father and brother are OBGYNs. And they are not asked if they are mothers. Right? They are not asked if they had delivered. And I felt like I should be your peer. I should be someone who can experience so much. I have periods, I've got cramps, I've got all the PMS. Hello, right? I'm with you. So I was somewhat offended by the idea that I would lack something. And I remember saying, not yet, but I can take really good care of you. Right? Not yet, but I care deeply about you and I'll treat you to the best of my ability. But it was in this moment that I understood what they were looking for. They were looking for this unspoken, this indescribable feeling of burden and privilege, of duality, of finding yourself and losing yourself all at the same time, of something that made me so much more aware of how deeply my mother loved me. And I said, I am so sorry. I see why you asked if I was a mother. You needed to know if I saw you, if you saw that person within you that desired so deeply to be seen. And so I bring this up because maternal means a lot of things. Obviously it says, we're relating to, belonging to, or characteristic of a mother, but it is what you understand maternal to mean. So there are people that mother people that did not birth them. There are people that nurture people, right, that may not even have a uterus. There are people that love and raise and rear that aren't necessarily called mother. Or there are people that you call mother who have no relation to you. And so I want to hold space for all of those people in this moment. Sorry, that was longer than I intended for it to be. But what I realized in all of my walks and in all of my talks, and certainly in talking with pediatric patients, is that my maternal well-being began right here, as this child. And I say that because it was the child that learned that she was a girl, it was the child that learned that her body was changing and certain aspects were coming, and I hadn't gotten the guidance. I told y'all my daddy is an OBGYN, okay? He hadn't told me a thing about periods. I was in a family of a ton of girls, and we didn't talk about it. And so I realized that so much of my relationship with my body and how it would change and the transitions, it started way before I held my baby. And that's what I want to impress upon you today. This is my life's work, to attack and change this, something that I noticed throughout my care, the miseducation of Black girls. And this is a generational pattern. I'm going to tell you why. For years, and for far too long in the reproductive health space, there's lack of culturally relevant education, representation, and certainly menstrual education. And I'll show you examples of that. there's also this shame and secrecy, and an element of punishment as emotional inheritance. As something that the day we are born and we are Black girls, it's like, this is what you gotta carry. And our mothers see it, and we see the heaviness in their eyes, and we say, do I want to take this? Do I want to take this on? And so there's a heaviness around it. And then, of course, it's a continuation into pregnancy and postpartum. This is just an example of some of the literature. I think the middle one's from like the 70s and the other one's like from the 90s. But the way in which femininity and menstruation and transition and womanhood and girlhood often leaves Black girls out as aberrant, as different. And this is what we get. When people see us, they see us as more threatening, more sexualized, more harmful, all of those things. The adultification bias of Black girls, so that we are really clear, is not just something that happens outside of our community, it happens within it. Because we were taught that we needed to be stronger, we need to be greater. And people looked at us and said that we were not as in need of nurturing, or mercy, or healing, or teaching. Right? But we still start our periods earlier. We still enter into these, right? It's so many aspects, and I won't be able to undo them all, but I want to build the case for why I believe this. And then the plight of Black mothers. We know that Black mothers experience disproportionately higher rates of postpartum depression, perinatal mood and anxiety disorders, with less support and significant barriers. And this is all related. So what I want to impress upon you is that psycholiteracy is mental health literacy, right? And it's mental health literacy in the sense of, we're taught from very young ages, oh, that's her hormones. Always in a negative sense, never a positive. Like, does estrogen help with anything? Right? Never positive. The connection is made, but we don't teach. We connect, but don't teach, right? And so my thought is, if we really leaned into psycholiteracy and really talked about it, we could have some mental health literacy. Do y'all know what we can understand if we just understood this right here? Y'all see this right here? This is one of my favorite infographics. I've used it forever. It's from 2013, y'all. Ain't nothing changed, okay? But almost no one understands this. So I want to take some time to just walk through this. This is the menstrual cycle in a beautiful kind of illustration form. Obviously, a cycle is a circle, and so there's no real beginning, but we have to pick somewhere. So if we start on the left, this is where our estrogen is low, and we just finished having a period. So, okay, and at the very top, I don't know if this is a pointer, but anyway, at the very top, that area is the ovarian cycle. The bottom is the uterine cycle. You with me? Love that, okay? Because we're smart, we can get this. Okay, and when our estrogen is low, we have just had our period and the lining is thin. The brain sends out signals from the pituitary gland. This is follicle-stimulating hormone. It stimulates follicles. We're not even that creative, right? And it stimulates the follicles in the ovaries, and the ovary starts to grow a larger follicle. Then that follicle starts to make more estrogen. And so you can appreciate that estrogen begins to rise. Then our brain, also in the pituitary, sends out LH, luteinizing hormone. Luteinizing hormone triggers ovulation. And once that follicle has released that egg, it turns into a corpus luteum that releases progesterone. This is why estrogen and progesterone are our key hormones. That's why we use them in hormonal therapy. See what I did there? Right? And when that progesterone is hanging out and we don't get pregnant, that corpus luteum slowly decreases and that progesterone drops. Correlating to the bottom, as estrogen increases, that lining gets thicker and thicker. As progesterone enters the world, that lining actually stabilizes until progesterone leaves the body. And that's what triggers your periods. If we understand this right here, we could understand PCOS, right? We can understand conception. We would then have a better idea of when we ovulate. We can understand that this little luteal phase, named for the corpus luteum, is the evil phase, right? Of PMS and PPD and all foolishness, okay? We can also understand the postpartum changes, because postpartum changes are primarily triggered by changes in our hormones. Our progesterone drops about 75% in the first few hours after delivery of the placenta. estrogen drops by 95% in the first 12 hours after delivery. And so, if we just decided to have more transparency and interest in conversation and education around our menstrual period, which is our physiological opportunity for looking at changes in our hormones, that could let us know who's more likely to have postpartum depression, right? All of these things, and I just say that this is my favorite diagram, because I can explain by looking at this. Many of our hormonal medications, I can tell you why progesterone-only medication works as a contraceptive, why estrogen is just around in those contraceptives for funsies, okay? Because it doesn't really have a real job, and so many other things, okay? But that's because education is the core. Okay, I'll be faster, because we're out of time. Okay. So what I mean to say is, if we don't talk about PMS, we don't talk about PMDD, postpartum depression is unfathomable. Like, what do you mean? What do you mean you can't cope? What do you mean it's too much? What do you mean it's too dark? Right? These make way for these, that the physiology, the pathophysiology is aligned. But if we never talk about those mental health changes that are physiologically occurring in our youngest, our future mothers, how can we support our mothers? So my thought is this: when we teach our daughters, we heal our mothers, but we also heal ourselves. Okay? The benefit of learning, right, is one, you get to unlearn. And unlearning is a process. I talk about this in my book. But when we learned from our grandmother, right, and what grandmother says is long, hello. When we learn from our grandmother that periods are dirty, or you can't use a tampon until you're sexually active, all of these things, they sound valid. And so my desire is not for you to invalidate your valid grandmother, but to separate the two, right? Give her grace, but also give yourself context and an avenue for learning something new. So what I believe this offers, when you lean into this opportunity to educate the future generations, you start to heal that girl inside of yourself that wasn't seen, that didn't have the context, right? So you gain context for your past experiences. You can release unfound shame and blame. There's so much shame that has us bound. And then you can make way for forgiveness of self and others that may not have known better. And then you unlock the power of language and self-awareness. So back to well-being, and I'll be quick. A measure of one's ability to enact their desired choices and balance life stressors and or challenges with their available social, physical, and psychological resources. So I want to break this down and then I'll close. Enacting choices is essentially having agency, right? The prerequisites for agency are education, power, and practice. Education says that I have a choice. If you don't know that you have a choice, you can't make a good choice. And we are robbing younger generations of the knowledge that they have a choice by not talking to them, by not teaching them. The daughter that doesn't know she has a choice of period products doesn't know she has a choice in doctors that she sees. Right? The young girl who thinks that ibuprofen is the only thing to help my cycle might grow up to be the mother or grandmother who thinks the hysterectomy is the only option. Right? The idea of beginning agency on this side, just when you show up with a baby in your hands, that's where agency shows up? That doesn't make any sense. But we do it all the time. So the education says that I have a choice. It says that what my choices are, you cannot make an informed decision if you were not shown the whole menu. There was a study that showed that Black women almost always choose the least invasive option when it comes to managing symptomatic fibroids. But we disproportionately get more hysterectomies. In a study that was led by a Black woman in Michigan, Dr. Erica Marsh showed that when we are presented our full options, we choose less invasive options. Because informed consent cannot happen if you're not truly informed on your options. But sometimes we are the ones who are withholding the options from the next generation. Because it's more comfortable for us to just say you have to use pads, and you can't do this, and you can never take birth control, and you can't take pain medicine because I toughed it through. We're perpetuating these generational cycles. And finally, education says, what do my choices mean? Because I can't make a choice if I don't know the consequences of said choice, right? And then power. then my choices are mine. If we never give our youngest administrators and our earliest folks the opportunity to make choices that are truly theirs, they cannot have agency. It is an impossibility. Okay? And then finally, practice. The appropriate opportunities. You know your child. You know the people in your life. Giving them the opportunities to act these out, to show their agency with safety, with your ability to correct and blunt them from the terrible consequences that would happen later in life if that was their first time showing agency. Okay? Back to well-being. The second part of well-being is balancing life's challenges and stressors. And this is more straightforward. We gotta be real about balance. We're not real about balance because we're not real about our struggles. We're not real about our struggles because we don't know and don't always accept that it's appropriate to struggle, especially in certain seasons, especially postpartum, especially that luteal phase, right? Right? We have to be real about what balance looks like to change future generations and their opportunity to achieve balance. So these are some of my favorite quotes that kind of challenge the myth and magic of balance. Balance isn't something you find, it's something you create, right? It's not this destination, it's a journey. There's no such thing as work-life balance. There's work-life choices, and you make them, and you have consequences, right? It's not all flowery, but it's real. Life is about balance, so we gotta be kind, but don't let people abuse you, right? Trust, but don't be deceived. And be content, but never stop improving. This is the duality. This is what we should be telling our next generations. And then life is a balance between what we can control and what we cannot, right? We have to learn to live between effort and surrender. That's something I'm still learning. And then finally, the last part of well-being is managing all of this with your available social, physical, and psychological resources. So social resources look like this: education programs and initiatives like this, advocacy, being involved and lending your voice to these people that need you the most, support, collaboration, finding community, building community. If it doesn't exist, make it. And being the community for anyone you come across that needs you. And then physical resources, right? People need physical things. Period products, right? Period poverty is real. Transportation. People got to get places. They got to get to their doctor's appointment, get to where they need to go. And then finances. Those are real physical resources that administrators need and mothers need. And then psychological resources. Encouraging, facilitating evaluation. Encouraging counseling and making sure the counseling is destigmatized. And promoting medication when necessary, right? Mental health is health, y'all. So as I mentioned, reproductive education is not just puberty, preparation, or period management. It's truly a maternal mental health infrastructure. And if we start promoting agency, resources, and balance to our youngest, our earliest, as they become aware of their bodies, as their bodies start to go through those hormonal changes, and not just make the connection, but start teaching them to have insight, because insight makes way for agency. And agency allows them to live the life that they deserve to live. That's how we truly affect change. It is my belief that what our daughters need today is what our mothers will need tomorrow. So together we thrive. Thank you for having me.